In these times of uncertainty, it's all the more important that we keep collaborating, informing, and inspiring each other, so that we can be smarter and better tomorrow. Welcome to the Pakhuis de Zwijger livecast.
Good afternoon, or evening, or morning, wherever you are in this part of the world. Welcome to Emerging Stories, very first edition, journalism in times of isolation. And every week I will invite different photographers, filmmakers, journalists, and writers from different parts of the world. I'm Kadir van Lohuizen. I'm a Dutch photographer from Amsterdam, and I'll be your host for the coming weeks. You can join the conversation by logging in via Zoom or via the website Pakhuis de Zwijger, which is dezwijger.nl. And via chat you can ask, you can talk with other viewers, or you can ask questions. Via the Q&A, you can ask the questions to the speakers, and the polling will not be working today. You can also watch via our live stream or on Facebook without asking questions. I would like to introduce you to my first three guests of today. My first guest will be Jan-Willem. He's the head of children, youth and media at Free Press Unlimited here in Amsterdam. And then via Zoom will be joining Mike Camber. He's a photojournalist and the founder of the Bronx Documentary Center in the Bronx, New York. And we have Claudia Hinterseer here, who's a visual storyteller and a senior video producer of the South China Morning Post in Hong Kong. Welcome to you all. With me in the studio is Jan-Willem. As said, you're the head of children, youth and media at Free Press Unlimited. Well, maybe you can tell a little bit about the work you are doing, especially about the work you are doing now in these times of the COVID virus.
Well, the work that I do for Free Press Unlimited is a major part of the work that I do as a filmmaker, as a TV producer, developer, teacher around the world. And the major project that we have in Free Press Unlimited targeting children and youth and media is a project called Wadada News for Kids, which is setting up, supporting the development of tailor-made news programs, either for children or for youth in countries. We built a network of already 21 countries. And of course, in times like this, but I mean, anytime, it is vital for children and youth to be well informed, to be represented on screen, and to be participating in the debates. And therefore we have developed this What Are the News for Kids project, which of course now...
And it's different parts of the world? Or
in all continents we are. Very strong in Latin America with 9 or 10 countries. Asia, Europe, Africa. So it really has spread over the world. And in many countries, especially in those countries where we manage to have it daily, you can really significant change in how children and youth feel about subjects, think about subjects, and how they feel about being represented on screen. And imagine in times that it started already in 2004 in Suriname. People didn't even put a camera on children. I mean, in the Netherlands, in Scandinavian countries, in North Central Europe, we grew up with seeing ourselves on television. From Pippi Longstockings to what is today. But there are many countries where you only show children on television when they're raped or murdered. And therefore, Free Press Unlimited puts a lot of effort in building this network, expanding this network, and supporting initiatives that are leading to tailor-made news for children or youth.
Because Free Press Unlimited in itself is an organization which advocates for freedom of the press and protecting journalists worldwide, right? So how is this connected to young people and what makes it different today, where we are in this basically where journalists cannot work anymore.
Where it's difficult to go on the street, and especially for us, going to children. I mean, usually you could go to schools and you can find kids anywhere on the streets. Nowadays they're locked in their homes, so it's very difficult to make these reports. Well, Free Press Unlimited, as the umbrella organization, of course, is a perfect place to do this project because it's connected to journalism, to high quality standard of journalism, gender equality in media, so the same policy we follow in the Wadada News for Kids project. But nowadays it's very difficult to go to the kids, so we decided to develop a project where we go directly in touch with the kids at home. And that's called My Quarantine Live. As you can see here, the website, the YouTube channel that we launched some 2 weeks ago, already having stories from Africa, Europe, Asia, and still growing, Latin America, very strong. And what we do is we just invite kids in a small format, which is introduce yourself, and then you have 1.5 minutes to do whatever you want, to say whatever you want to say. And it's amazing what children and young people are delivering there.
Can we look at something?
Hola, me llamo Lorenzo, estoy completando mi cuarentena en Buenos Aires y es mi último proyecto. Bueno, este está siendo un pasatiempo increíble porque, bueno, últimamente estoy teniendo bastante tiempo libre, pero es algo que no pude haber hecho en mi rutina habitual por no tener el tiempo, así que esto me permitió llevar a cabo este proyecto que siempre quise hacer. Básicamente es un robot que puede caminar, tiene una grúa, un par de ojos saltones que son increíbles.
They want. So how do you connect to those kids? I mean,
yeah. Well, I've been working quite a long time now in children's and youth media. I've been the head of one of the major broadcasters in the Netherlands for many years, and working in many countries. I've been working myself already in something like 65 countries, working on media in general, but specifically on media with children and youth. So I'm using that network, and I'm doing this together with Aldana Dualde in Argentina. So we have built an online editorial process. Who is very well connected and known in the Latin American region. That's why we also have this channel now already in 2 languages. We have English, and most of it is subtitled in English, and we have a lot of Spanish-speaking stories as well. Iran, an animation coming from Iran. This morning we uploaded the first story from Africa, from Zambia, a girl who had her birthday yesterday, her 15th birthday, in quarantine, and tells us how she feels about it, while holding incredibly nice cake, I have to say. So it's interesting that the only thing that we say to them, it has to be 60 to 90 seconds. So it forces them to do something more than a 15-second TikTok. So immediately they start to think about stories, and they start to edit stories. Sometimes they edit stories just in one shot with their camera, with their mobile phone. These girls, they made an animation, very high quality animation. They are 17, but they're also, we have an animation from Iran from a 9-year-old girl. And imagine in the morning, then suddenly I get a phone call from the mother in Iran asking me how to upload it. This morning I was in touch with Zambia. The things that are happening is incredible. And what kids and young people give back to us the mostly is that how proud they are to be shown, but also to be part of an international channel. It's incredible how it encourages them to feel something, to feel somebody.
And is it similar what they send to you? I mean, I can imagine that if you're from New York, or you're from Kinshasa, or you're from Hong Kong, or Mexico City, is there a lot of difference? Is it very diverse?
Yeah, I mean...
What is the main message that
The main message of the kids, and more they start to feel confident to also criticize. For instance, the girl of Zambia made a remark about the government. So totally surprised us that this engagement. Another girl from Mexico clearly says, "I don't like to be in quarantine. My life sucks now. I really want to get out of this." They don't get that chance to say in their own country, or usually people wouldn't listen to them. We give them the platform and they use it. This girl, for instance, from Argentina, she just offers us a song that is about distance. Distance doesn't matter, it's the translation in English. So yes, we receive all kinds of things from around the world, but the key point is that they share their feelings about quarantine, and they want to encourage each other. I think that is really strong part, is how they encourage each other, be creative, sing a song, but they don't copy each other. So far, I expected, for instance, when we got the first cooking item from 11-year-old Vicente from Argentina, I expected now many kids will cook and we got one or two more. Same with music. You would expect they all try to use this platform to show their musical talents and to become the next voice of their country. It doesn't happen. They are really engaged to share what they think about the quarantine, to encourage each other, and to show something that they are really interested in. Could be building a robot, it could be playing music.
But I'm still a little puzzled how this is connected to because it's a journalist organization, right?
Well,
an organization for journalists.
Yeah. Well, a good journalist listens to his audience, or the one you interview. That's what we do. We listen to them. Mm-hmm. Of course, journalism for children or youth is another approach than when you talk about journalism for adults, because you have limitations in the words, the vocabulary that you can use. You have the knowledge is different, but also things are less relevant for kids sometimes than for adults. So we always have to find, okay, if this is happening in the big world, what does it mean for the child? What does it mean for this child's life, this daily life? So we have to transform that into subjects that are relevant, that are important for them, relevant for them. For instance, in this case, kids really feel locked up. They are not listened to. They're not asked, "What do you think about it?" So they need to express themselves.
And it's quite different, right? I mean, I think we realized that here in Amsterdam and other parts of Europe and other parts of the world, we have a privilege that we can keep a social distance, right? Which in many parts of the world is not even a possibility. Do they speak about this? Are they talking to each other?
No. One of the disadvantages is that we are on YouTube and we put it in a kids mode, which means that you cannot comment. That is. I wish we could have that possibility, but I think it's better that we don't have that possibility for those who would destroy what we're doing. No, I think they speak to each other through their videos. Mm-hmm. So they know there are kids out there from around the world in different circumstances. They feel from each other what it is to be locked at home, to be pushed by parents, by teachers, that they have to perform. Mm-hmm. That's also one of the things that they remark is that they really don't like. They try to do their best with their homework, but it's not. They don't feel comfortable about it, and they don't like the pressure that is in some cases is on them. So I think that is journalism for kids in its purest form, is to open up, to listen to their stories, to have peer reflection to each other, because one says something, maybe reacted on something they saw on one of the other videos, and we are the intermediates there, and taking care that those videos are subtitled. In some cases, we are directly in touch with the families, with the kids, helping them to edit, because sometimes they're capable of making some shots, but not the editing. And we think it's very important that those kids also have a chance to be shown.
And how long you're gonna go on with this?
Well, a short calculation of how long will millions of children and youth will be locked up. I mean, let's say in general that will last at least for the next 3 months.
Right.
So we have said, okay, let's put this project at least for the next 3 months. It's absolutely a 24/7 thing because videos come in, questions come in, reactions come in. So yes, I'm really day and night working on this, as well as Aldana in Argentina. Some great friends that we have, like a satellite partners in some countries, like in Mexico, we get a lot of material coming from an organization called Vientos Culturales that is very active in the country to reach out to kids that they can have the possibility to make their videos. And like I said, kids are very interested in the fact that they're part of an international channel, that they are there, and that they have, some kids have suddenly English subtitles. That's an honor, you know, to have English subtitles.
And they get many views, or it's growing?
Yes, it's absolutely growing. This kind of projects often are, you talk about hundreds instead of thousands of viewers. Many children's film festivals try these kind of things, and if they reach, you know, a dozen or 2 dozen of viewers on, we're already past the 7,000 views. We already have reached over 35,000 people, and it's absolutely growing. Some of our videos are already over 1,000 views, which is absolutely high numbers for this kind of project. And imagine it will grow and it will grow. The moment you offer a child the possibility to have the video in the channel, you can immediately see in that country the ratings go up because the whole family, friends, the community, they all start to watch.
Yeah.
So it's also for a child a great way of communicating with its environment, even though it's part of an international platform.
Thank you, Jan-Willem.
Thank you.
Let me see if there's any questions. I don't think we have any questions right now, but thank you very much for being here. And
my pleasure. Thank you.
Good luck.
Yeah, it's an incredible project. So
yeah, it is.
Happy to tell about it.
Thank you. My next guest, Claudia Hinterseer. She's a senior video producer at the South China Morning Post. She's actually Dutch, but lives in Hong Kong since a couple of years. Is that right, Claudia?
That's right, Kadir. It's been 5 years already.
Okay. So, yeah, I mean, Hong Kong, you know, I think a lot happens in Hong Kong lately. We've seen all the protests. Can you tell a little bit about let's speak about the last year, right? What all has been happening in Hong Kong?
Yeah, it's been quite an eventful year, let's say. Who would have thought that with Hong Kong? I remember you always saying this was the most boring place on earth. So yeah, the protest started about well, the whole events surrounding the extradition law started in March, but like it was in June last year that the protest started, and actually it didn't really stop until December. One of the main events was in November when the universities were occupied, and it really got out of hand. And then in December there were a few more protests, and then with the arrival of the coronavirus in town here, which already became a big deal end of January, people became very cautious. The protest kind of made place for a lot of coverage in our media organization about the coronavirus, first in Wuhan, China, and then slowly as it spread around the world. So yeah, we've been quite busy.
But it almost feels like the epidemic, the pandemic, silenced the protests. Is that a true impression or not completely?
In a way, it has, yes. Because I mean, now is really not the time to go out in mass protests. And of course, I live in a place where SARS was a big deal. and a lot of people that are from the generation of the protesters, they experienced that when they were young, and so it really has a relationship. This is definitely not the time to go out onto the street. There was a small protest. There was a commemoration event just a few weeks ago, and actually a lot of it was just a small event, and some of the riot police involved actually were afterwards. Two of the riot police were confirmed positive with corona, and the whole battalion had to be quarantined.
Because obviously these protests were very much against the government of Hong Kong, or how the government of Hong Kong is in bed with the government in Beijing. What's the status of do people have more trust in the government now in Hong Kong, or how should we read this?
No, I don't think that's really related. Like at the moment, I think it's as divided as it has been for the past year. There's a lot of pro and cons to say of how the leadership treats the situation. But I don't think the fact that there's no protest at this moment is a way of saying that people are fine with the situation. I don't think it's related in that sense.
Good. How is the situation in Hong Kong? If we talk about the COVID virus, how Hong Kong has been dealing?
Yeah. So it's curious because actually since it started, like it started pretty early here, because except for one fatality in the Philippines, then the first fatality outside of mainland China was in Hong Kong, which was quite early on when the outbreak started. And then Hong Kong immediately reacted quite strong. People were quite disciplined. A lot of people wear mouth caps, face masks. And so again, like one of the explanations here, people have experienced SARS, so they know how to kind of deal with these kind of outbreaks. And so it was contained really, really well. And then I was in the Netherlands for 3 weeks, and then the first cases appeared in the Netherlands, which I hope had nothing to do with my presence there. And I returned to Hong Kong, and at that moment, Hong Kong was actually kind of the example to the rest of the world, because the curve had flattened somehow. The mortality rate was very low. But then a lot of Hong Kong students and other people that were living and traveled abroad came back and imported cases. And so all of a sudden, it went from about 100, it was contained at 100 cases here, and then all of a sudden now we're above 1,000. And so also the measures became stricter because we went back to the office. And then just after like a few days, we had to go back home, work from home. And it's quite loose in Hong Kong. Everybody is just super disciplined. People do social distancing. People do wear face masks. There's like every place you enter now, they take your temperature. So it's super organized.
But you
in
are
that sense.
But there is kind of a lockdown. I mean, you're not working in your office. You're working at home, right?
Yes. Most people are working from home. People that can work from home are working from home. Schools are closed. Most schools are closed. Bars are closed. There's a measure that you cannot have, officially you can't have gatherings of more than 4 people. So yeah, there's all these measures in place. But it's still quite loose compared to many other countries.
Can you still go out to a restaurant or?
Yes.
You can. Okay.
Yeah.
Hey, well, maybe I think you brought a small video piece, right? Maybe we can have a look at it, which was done by your department.
晚回来很晚哟，这边检疫办的手续太慢了。问你是从哪块返回来，完了多少天？以前有问说有个什么完到香港到什么地方？6点多能到深圳湾了，10点多才出关呢。反正这边已经快12点了哦，睡下了还好，当天还好，但第2天你知道了，你就很不高兴啊，都很害怕啊。但心情可以理解嘛，他搞得我也没办法呀，哎，或社工施工令完了之后帮我联系，哎，还好。去了隔离营啊，那环境挺好，6个人一个房间，在他那个有限区域内可以说是走一走，哎，户外的，天天自己量体温呐，黑色的单人床啊，条件很好的，比我这强多。上下的龙房啊，人家起码是房间呐，住得很舒服啊，哎，吃啊什么的都政府负责，3餐完还有水果。如果得的话，确实很害怕，因为他们有特效药。我们这18个人住一起，感觉很不安全嘛，因为他们各行做什么魔业的都有嘛，天天都出去嘛，你也不知他们接触魔业人呢。只有自己侥幸吧，回来喷那药水了，洗手了，换口罩了。希望这疫情尽快结束吧，是不是？这是人类的一个灾难呐。
So, I mean, he lives in this tiny room, right? It's like...
Yeah, it's so-called cage house.
Okay. Because you...
Yeah, so...
Yeah, go ahead.
No, because we were going to talk about doing journalism in times of isolation. So I thought I presented you this video that one of my team members made, one of my colleagues, Shanshan, which is very much a story in the periphery of the events taking place in Hong Kong these days. We at our newspaper, we have very strict rules that none of the journalists is allowed to get anywhere close to infected people. We're not allowed to enter hospitals. We're not allowed to get close to hospitals. So we're looking into all types of stories that we can tell that how people are impacted by what's going on. And these people, this man that was part of this video, he's really at the bottom of Hong Kong society. He lives in a very tiny place with a lot of people in very small space. So it's really hard to social distance. And yeah, I think he's a really good character. He's the way he describes how people reacted to him having traveled to China. I thought it was a good example.
But you know, I mean, you said that people are, you know, they really take care, they apply social distancing, but this is impossible, right? The way, and he's not the only one who lives like that. So how
no, there's a lot of people in Hong Kong that live like that. So this is a super big issue, just as much as all the people that are left without jobs, access to food. I mean, I think worldwide, like a part of the work I do, I run a small team, and we cut a lot of videos of international news. So we work with wire material. And so I look at the footage that's being made all around the world by agencies like AFP, AP, Reuters, Robley, name it, CCTV. And if you look at what's going on these days around the globe, one of the red lines, one of the central themes is actually that this whole pandemic has a very serious impact on people's access to very basic necessities, not just schooling, but also food. And so in Hong Kong, this is also a big deal. Even like at the beginning of the pandemic, I think now we're very much ahead of a large part of the world, but now we all have face masks. But in the beginning, there was a shortage. There was a lot of anxiety. People started buying rice. Toilet paper was a big deal here. So you had all this panic buying, but yeah, just people like, and you don't really have to be at the bottom of society to have like serious big issues right now. Just paying your rent, getting food in your family's mouth.
So, but is there like a social security system? You know, people who are really living kind of in poverty, are they getting any government support?
Yeah, so there's just now last week there was like a support measures that were announced. Like many countries in the world, they come out with ways to deal with like the high unemployment, etc. So Hong Kong too. Hong Kong actually has a large budget compared to a lot of other places in the world. I think it's only second to Switzerland how much extra money there is in the bank here. Normally there's not a lot of social networks here. But yeah, so there's a budget, there's plans of how to deal with unemployment, how to deal with small businesses. I think there will be tax cuts. So there's all different kind of things in place, how to get through this, through this situation.
Hey, you mentioned that it's hard to work as a journalist in Hong Kong, right? That you're not allowed to go anywhere close to the hospitals or to people who are contaminated, actually. How are you dealing with this? Because we see different images, right? From Italy
I must say, I think a lot of large media organizations have the same rules in place. Many organizations rely on wire services and on freelancers. And I'm pretty sure that if my organization didn't have these rules in place, that a lot of my colleagues would also come back with stories from the front line of the pandemic. But of course, we have to follow the rules of our employer. So it's tough. So we're all looking for stories that tell the story, what's going on right now. But I think it's kind of the same everywhere. There's a lot of social media videos out there. Like all I do is video, right? So I'm talking about video productions. So there's a lot of social media. There's doctors that enter hospitals and just record what they're doing, what's going on. There's some patients that come out that record their experiences. And then there's freelancers that may take certain risks, I would call it, that maybe nobody tells them not to do that. I'm not saying that that's good or bad, but I guess that's how it's happening. And there's a big reliance on wire material at this moment.
So how do you, being Dutch but living in Hong Kong, how do you look at the situation in the Netherlands and in Europe? You know, I mean, many people say that we responded too late. What's your take on this?
What's my take on it? I find it a little bit insulting that, so to say, it seems that the rest of the world didn't take any of our writing serious in the first months, because I do think that for a long time we've been telling the world this has been coming. Like South China Morning Post tells the story of China and this part of the world to the world. That's our mission, and we've been writing crazy amount of stuff and bringing a lot of videos about what's been going on both in China and in this part of the world. And so I think there was it was really clear from the beginning that this wouldn't just be staying at this part of the world and that the rest of the world should get prepared. And it seems that there was a little bit of arrogance, like this is not going to happen to us, or this is just going to stay in China or whatever. I feel that there's in many ways a really a missed chance of a containment that could have been done so much better, or maybe just a preparation in terms of all the medical supplies, etc. It's just I think from a journalistic perspective, it's interesting to see how different nations, different cultures deal with it differently. The Dutch, I'm Dutch. I kind of got used to the way Hong Kong people deal with the situation. They're very disciplined. It's always been a very hygienic place, again, because of the SARS experience. But now, I mean, if you don't wear a face mask, people look at you like, come on, you know, like we're all in this together. And I know, for instance, from friends and family in the Netherlands, that people still kind of laugh a little bit when I talk about face masks and say, yeah, it's not that, it's not, or they meet up with friends because they think it's not going to happen to them, et cetera, et cetera. So it's interesting to see how people react differently to it.
But you know, I mean, maybe we thought, okay, SARS has been in Asia before, was contained, never came here. But I'm still a bit puzzled how we missed all this. Is this?
Yeah, I think maybe the world maybe just slightly more interconnected than it was back in 2012, 13. People are traveling way more, of course, nowadays. Also, as far as I understand, in the researches, it's kind of a more fierce virus than SARS was. It transmits easier from human to human. So yeah, I think there's differences from those days. I have the impression that I don't know what happens. I just have the impression that people kind of felt like it's not going to come to us, and it's far away, and that was, I believe, a pretty bad miscalculation. But maybe Mike can say something more about like the perspective from the United States.
Yeah. Hey, I mean, formally, Hong Kong is part of China. Can you just go into China and come back?
No, these days we can't. So this was all the way at the beginning. This was a big deal because there were protests from medical personnel in Hong Kong because people here felt that the border had to be closed immediately. Some people felt that, and they felt that our chief executive and our politicians reacted too slow to it. So there was like a moment that it wasn't closed off, but as the crisis became bigger, as the health crisis became bigger, also the measures became stricter. So first it was just people that had been in Wuhan. If they wanted to come back into Hong Kong, they had to be in self-quarantine for a while. Then there was like state-organized quarantine, depending from where you came from. And now it's just anybody crossing the border has to be in self-quarantine, depending where you're from. I think if you're from Iran, or nowadays probably also the United States, it will be a little bit stricter. Now the borders are closed. Hong Kong is still officially part of China, but the borders are closed at this exact moment.
I think we have.
They're not closed. They're not closed. They're not closed. They're just
okay.
Like if you want to cross them, you have to be in 14 days self-quarantine.
Right. There's an interesting question from one of our viewers. How do you see the near future for yourself in Hong Kong? What will be different? You know, I think today we got reports from the US, from Harvard, that social distancing may still be necessary till 2025.
Yeah, good question. I see my future here. I think especially in my field of work, it's never been busier, and it's very interesting the work we're doing, and so I'm for the time being guaranteed with a job, which not an awful lot of people can say if you work in restaurants, hotels, etc. So work-wise, I'm good. Social distancing, I think I think it's quite positive to say that it will be a matter of months. Like I think this may actually really change the way people deal with each other. Here already, like when I first came to Hong Kong, I thought it was interesting because people freaked out if you would sneeze in public. You know, like people, that was like the most awful thing you could do. And this is, again, going back to SARS. I think the rest of the world would get into that, because now we all know that that's pretty much not what you should be doing. You know, like you sneeze in your elbow, whatever you do. I think social distancing may just stay. There's talks now of making a face mask obligatory, like something that you always have to wear in public, at least for the time being. I think this will have like a fair impact on our social being together. I don't think Hong Kong will be much different from the rest of the world in that.
Last question, the interesting question from from Sarah. How do you feel about using this Corona apps? You know, I mean, like in the Netherlands and in Europe, other places, there's a lot of discussions about privacy. I think you and China as a whole, you've been. How do you view this?
Yeah, that's a complicated thing to answer because I think every place has very different apps, right? So the app in the Netherlands, for instance, it's completely unclear what that will entail and how it will deal with your privacy. I know, for instance, in South Korea, it's completely different. The Wuhan or the Hubei app now used like these color codes. So I think these apps are very different everywhere they are. I think in Singapore they also have a very strict app that kind of puts everything online where you've been in the last hours if you're positive. Yeah, plenty of questions. I think it should be not something. It should be something that you can opt out from. I think.
But it's possible. Is it possible?
Well, here in Hong Kong, we don't have it, right? So this is not something that's implemented here. There's just for people that arrive on flights from, or anyone arriving these days, you're being traced for a little while with armrest and a barcode and some app. But this is not, I don't think if you leave the hospital, if you have had an infection nowadays, there's an app in Hong Kong. Not as far as I know.
Okay. We have to leave it here. Thanks a lot, Claudia. And wow, it's already late in Hong Kong, so have a good night and stay safe.
Yeah, I'll hang in there a bit. I'll listen to Mike. Thanks.
Thanks, Claudia.
Okay. My next guest is Mike Camber. He's a photojournalist from the Bronx in New York. He's a founder of the Bronx Documentary Center in the Bronx. Welcome. Good morning, Mike, right?
It's morning. Thank you.
Yeah. Thanks for being here. And yes, well, we hear a lot about the US lately. I think yesterday New York topped over 10,000 deaths now just in New York City. It's being called the epicenter, and I guess the Bronx is the epicenter.
It is, yeah. I think per capita we've got the highest number of deaths, probably anywhere, certainly anywhere in the United States, no doubt about it.
Can you speak a bit about the Bronx because you know it very well? What's going on there?
Well, I think, there's a number of underlying issues here. The South Bronx is one of the poorest congressional districts in the United States. So, people get by on very little money. They're packed into apartments. There's frequently, 6, 8, 10 people in an apartment. There's not a lot of space. People don't have health care, don't have health insurance. The highest rates of asthma, heart disease, and other, underlying health indicators, some of the highest rates in the United States. So there's a lot of underlying problems, and coronavirus coming in here with a really vulnerable population that's packed together is just a predictable disaster. It's been really, really tough.
Do people take it serious now? Because I remember that I think it was only a few days ago I saw a picture of the metro. I think it was going to the Bronx or coming from the Bronx, which was packed.
Packed, yeah, packed. Again, that's another issue. We've got, there's two different issues. One is that, there's a lot of low-income workers here, families that are living day to day, week to week, and they can't simply stay home for 2 weeks. So if they can get to work, they're going to go to work. They don't have much choice. And, again, the middle class and upper middle class and wealthy New Yorkers, of course, they can afford to stay home. But when you've got a family and you're the only person working, you're going to continue to go to work. And you'll see, hundreds of people still getting on the subway together because, there's no choice. And then the subways are running less frequently. So when the train does come, everybody is basically crowding in together. potentially disastrous situation. The second issue is the belief, and I can say that as recently as a couple of weeks ago, people really did not believe that this was real. Many people did not. I can't speak for all people in the Bronx, but there wasn't good public information around it. Most people here, many people are not English speakers. They don't read the New York Times, and they're not getting good information about it. We went into public housing here. Many people here live in public housing, hundreds of thousands of people in the Bronx, and there was no information whatsoever about COVID-19 coronavirus. So, there's very little public outreach. New York City did a very poor job on communicating about this in advance. Our mayor was telling people to carry on, until not so long ago. He did not. He actually fought closing the schools until some of his advisors threatened to quit. So there's been a lot of contradictory messages. Of course, we've got a president who is contradicting his own health advisors and even contradicting himself on a day-to-day basis. So it's not surprising that people did not believe that this was coming or understand that it was coming. And it wasn't until quite recently that people began to really stay inside and cover up and wear masks.
I believe you did a piece recently for the New Yorker, right? About social housing in the. Maybe we can have a look at it.
Sure.
I think we have a small clip.
Right.
As the coronavirus tears across New York, the New York City Housing Authority, better known as NYCHA, has done almost no outreach about the pandemic, according to residents I spoke to. Over the past weeks, I found many residents with almost no information about the dangerous flu. My name is Mike Camber. I live in this neighborhood and my family members live in these projects. Volunteers from the Bronx Documentary Center put up flyers in NYCHA lobbies and around the neighborhood to counter the lack of information.
I don't know. I mean, we sent notices and posters to each property.
Okay.
Actually, we sent pretty much the same, I can't remember, it's Department of Health notice. We sent that to the management offices.
Okay.
And asked them to post as many as they had in common areas and the management office.
Most of the few notices that we found were designed to protect NYCHA management, but gave no information for tenants to protect themselves. There is no hand sanitizer here in these crowded lobbies, no alcohol wipes, and no apparent plan for help.
You're a photographer, you look like a health worker, activist.
Well, we're primarily a photography and a journalism organization, but we're community-based, and what I saw was that there's a huge lack of information. So we're trying to reimagine ourselves as we are a place that people are coming to and asking for information. People know in the community that we're journalists. They're coming. They're saying there's a gap here, and we need to know what's going on. So we began to do a public health campaign, even though, of course, it's not something I ever dreamed we would do. But where there's a vacuum, you have to try to fill it somehow.
I mean, you covered a lot of wars, right? You've been in. I think you were based in Iraq for a long time for the New York Times.
Right.
I mean, you cannot maybe compare a war to a pandemic as we are seeing it now, but maybe could you talk a little bit about the scenes at the hospitals and what it's actually like right now?
Yeah, well, I mean, this has been a really tough thing to cover for journalists and photographers. Obviously, it's kind of this, what we call a catch-22. You've got 11,000 New Yorkers who are dying, but yet it's an invisible thing. There's no front line. There's very little to photograph, and you're being told to stay inside. And the streets are empty. So it's an impossible situation to cover. I have been down to the hospital. I can't go inside. They won't let me inside. They're very careful, understandably. But I've spoken to the ambulance crews, and they've been working around the clock. A lot of the ambulance crews have gotten sick, and we took. I had some masks and alcohol, bottles of alcohol, things like that I took down to them because they actually didn't have, the ambulance crews that are on the front lines actually did not have protective gear. That was about a week ago. So, they said, please, they said, we need paper towels, we need alcohol, we need, any type of protective gear that you have. And so we took that down and donated it. But it's incredible that the richest country in the world can't provide this for its healthcare workers. Mm. And I do know from speaking with a couple of friends of mine that have Victor Blue, a great photographer, spent some time in a hospital in Brooklyn, and there's a video of that on the New York Times website. There's a few other people who've gotten in, and they say the inside of the hospitals does look very much like a war zone. There are just people lined up in the corridors. There's no beds. Obviously, there's been a well-publicized shortage of ventilators. Different patients sharing one ventilator, which is something they've had to improvise. So, I think it's been an extraordinary, and a predictable sort of shortfall on the parts of our healthcare system. We don't have a national healthcare system, as I'm sure you know. So it's been very tough for us to respond to this in a coherent manner.
Hey, I mean, you were talking about the Bronx earlier as being a low-income neighborhood, very diverse in terms of population, I believe. I think your president is signing a check personally to all Americans where they get some financial support. What does this entail for someone from the Bronx?
I mean, it
16 million people got laid off, right? In the last 2 weeks.
Yeah, we're looking at, what are we looking at? Upwards of 15 to 20 million people have lost their jobs. So it's been incredible, possibly more. I mean, I know many of my friends here, have lost their jobs, and they're surviving on unemployment, but it's tough because if you're making $600 a week, your unemployment is $200 a week. So, how do you survive with a family on $200 a week? It's extremely difficult. We are finding, we have been organizing food deliveries to our, immediate community, and we were put in touch with a woman a few days ago. She had not eaten in 3 days. A lot of people here don't have internet. Many of them don't even have cell phones, so it's very hard for them to request aid, to sign up. In Manhattan, people say, well, you can just go online and sign up for free food. Well, if you don't have a computer and you don't have internet, you can't sign up for free food. So, there are a lot of people, especially the seniors. We deal with a lot of seniors, people 65 and older. They're in an extremely, extremely tough situation here. Yeah.
So do you dare to look ahead a couple of weeks from now?
I mean, our Governor Cuomo has been pretty good on this, and he, there seems to be some flattening. They speak of the flattening of the curve, of course. It seems like the deaths are starting to come down a bit, but it's very tricky because, obviously, as everybody knows, we're in a city of 8 million people. The entire structure of the city is about being packed in together. We're packed into offices, we're packed into subways, we're packed into concert halls and events and cultural, everything. So to suddenly, take a city that's created on this incredible density and say, okay, we're going to have social distancing for the next year, 2 years, 4 years. I mean, it just doesn't work. So it's really impossible for me to make a prediction on this. I don't understand how it's going to work, but if one of you does, I'm happy to hear suggestions.
I think we have a question from our audience, Mike. Do different US media present the pandemic differently? she has the feeling that the right-wing and the left-wing media can portray the situation from a very different approach. Is it also the case for COVID?
Absolutely. Yeah, there's been an extraordinary divergence of the way it's been presented. The right-wing media is primarily Fox News, but there's other forms. Sinclair Broadcasting, which owns TV stations all over America. Sinclair and Fox are the major conservative news outlets, and it's been very well documented. I mean, Fox spent weeks and weeks and weeks calling this a Democratic hoax, calling this an ideological, plot to damage President Trump, et cetera. So, and you have to remember, Fox News is just not a small, media outlet. Fox News has more viewership than I think MSNBC, CNN combined. So there's a huge tens and tens of millions of people are watching Fox News. And certainly until recently, they've been extraordinarily irresponsible and have talked about how this is a hoax. I can't speak to the left so much. I know the left was very hostile to Trump's stopping flights to China. I think it was January 28th. And in retrospect, a lot of people now believe that was one of his few good decisions. So I think where you stand on the coronavirus was very much dictated by your politics, which is unfortunate, because we should be looking at science and not looking at right-wing, left-wing, Democrat, Republican.
And is there, which is adding to the same question, is there one authority or source where the media refers to, I mean, like scientific, I think we all know Dr. Fauci.
Right.
Because it sounds to me that most people get their information from the media.
Exactly. Yeah. I mean, I think even, Dr. Fauci, I think when he's standing next to President Trump, who's actively contradicting him, it's quite an extraordinary thing. I think when you've got a president standing up there saying, you should all take hydroxychloroquine because what have you got to lose? He's giving out medical advice that has now been proven to kill people through heart attacks. So it's quite a bizarre situation. And I don't want to blame it all on Donald Trump. It's much more complicated than that. But I don't think there is one place. I think a lot of people are watching those daily briefings, of course. And I think the CDC, I think it's a tough situation. I don't think there's one trusted place that people are really going to get their information in the United States.
Mike, I want to thank you very much for being here and for the incredible work you're doing, I think, for the people in the Bronx as well. And stay healthy as well and be careful.
We will, definitely. Thank you so much.
Thank you. Thank you all for watching this first edition of Emerging Stories. Next week, next Wednesday, we will have another edition, the number 2 edition, and I can tell you already who are my guests, which will be live in the studio. It will be Linda Polman, well-known Dutch author and journalist, who will be speaking especially about the plight of the refugees on Lesbos and on the Turkish border, where she's been recently. On Zoom, I will have my colleague Tanya Habjuka. She is Jordanian American and she lives in Ramallah, in Palestine, and she will talk about the situation in Palestine and in Israel. And my last guest will be Nana Kofi. He's a photographer from Ghana, from Accra, actually, and he will speak about the situation in West Africa. So thank you again for watching and hope to see you next week.
Thank you.